Now we have to discuss the 4 skills. So let's start discussing the 4 skills. Let's discuss the tips, strategies, the things that you have to know concerning every section. Absolutely, section number 1 is about listening exam, listening section. Okay. Now, in the listening section, Joel, the OET listening test consists of 3 separate parts with a total of 42 questions. This is number 1. And you have to do so in 40 minutes. It's like the IELTS exam. You can only hear the recordings only once. So please, you have to be familiar with all the format, the structure of each of the 3 sections, 3 parts in every section before you before applying for the OET exam. So all the listening content is appropriate absolutely for healthcare. It's not about everyday English. It's not about being in the market, for example, or in the supermarket, in the school or something like that. So everything, I'm talking now about the 4 skills, everything is connected to the 12 different professions, which is about medical workplace. Absolutely, you don't need or require specialist knowledge in a particular healthcare field, because maybe it's going to be about nursing, maybe, as we said, it's about animals, curing animals, maybe in the hospital, maybe pharmacy or something like that. It's not about nursing or to be a nurse, so please be careful. Okay. Now let me scroll down just to try to check the most important areas I have to tell you. Now, the 3 different parts of the listening test are described them below. I'm going to discuss them with you. Now, in part A, we have part A, part B, and part C. Now, in part A, you will hear 2 different consultations in each of which a healthcare professional is talking to a patient. So we will notice that in part A, in general, we have, for example, doctors or pharmacists. They are talking to patients and they are listening to them. Maybe they are asking them about a treatment or maybe symptoms or maybe the history, about the disease, for example. So there is one note completion task with 12 gaps. So this is section 1. Section 1 is going to be about 12 gaps you have to fill for each consultation. Part A lasts around 10 minutes and tests your ability to understand and record specific information about patients. So this is part 1. Now part 2 is about part B, sorry, is talking about, you hear 6 different extracts from the medical workplace. Now in each extract, you hear healthcare professionals either talking to each other or maybe talking to a patient. Now, there is one multiple choice question to answer about each extract. This part B, lasts again about 10 minutes and tests your ability to understand everyday workplace interaction with patients and medical, as I told you, workplace. Now, after finishing solving part B, now it's the time for part C. In part C, you have to hear 2 longer recordings. If you remember, Joel, in the IELTS exam, you notice that in the listening, I'm talking now about listening section, you notice that all the time, the last section in listening, it's about long lecture. A speaker is speaking for approximately 8 or maybe 9 or 10 minutes. So this is not the same, but you have to know that part C is going to be the longest. Absolutely, each recording is either an interview or a workplace presentation on a certain medical topic. There are six, now in the part C, there are six multiple choices or questions to answer about each recording. This part lasts for 15 minutes. So 10 minutes plus 10 minutes plus 15 minutes, and tests your ability to understand the speaker's ideas and experiences related to the prompts or topics. Okay, now before each recording, absolutely you have to hear the information about the context. The speaker, before the recording, the speaker is going to tell you the name of patients, is going to tell you all the information concerning the recording. And we will notice that we have instructions about what we have to do. Reading the instructions, Joel, is extremely important. You have to know what you have to do exactly. This information will also be printed on your test paper before the beginning of every recording. And absolutely, the speaker is going to give you time, 3 minutes, 2 minutes, to read all the questions and to read the information before the speaker is going to start speaking. Okay?
Okay.
Okay, so let me try to check the most important information. This book, instructions, receive. Okay, the topics are up because we said this before. You have to, as I told you, use the time that you are given before each task. Okay, there is something you have to do, Joel. The speaker, for example, is going to give you 3 minutes to read the questions before the speaker is going to start speaking. You have to try to do the best to finish reading all the questions before the speaker is going to speak. This is extremely important. If you want to ask me why, because you have to gather the main idea, or you have to know the main idea about the questions. If you want to know the main idea, Joel, you have to circle the keywords. Circling the keywords is extremely important. You have to circle the keywords before the speaker is going to speak. If you want to ask me why, because believe me, Joel, your brain can focus only on one mission. It is impossible to read and write, or maybe to listen and read at the same time. Don't try, because some people try to listen and read at the same time, but they failed. Please, this is extremely important. Let me show you a picture I've seen lately concerning the international exams. I'm talking about all international exams. I'm talking about TOEFL, IELTS, OET, PTE, any international exam. So you notice that it is impossible for us to listen and read at the same time. So please don't try, because you will not be able to do it. Our brain, as I told you, can focus only on one mission. Don't defy yourself, because you will fail. Okay. Let me try to read if I can notice anything which is important. You can use information. Okay, you may find it helpful. Okay, not you may find it. You have to circle and underline the keywords, the main ideas, because these ideas, Joel, are the ideas the speaker is going to talk about. This is number one. Number two, you have to select or circle the main ideas before the gap. Now I'm talking about part A, before the gap and after the gap. Why? Because again, if you want to circle the keywords, now your job only to take a look at the circle keywords. You don't have to read them, because as I told you, if you don't want to circle the main ideas, the keywords, you will not be able to read, because if you want to start reading, your brain is going to stop listening. So by circling the keywords, now your job only to take a fast look at the keyword, at the underlined word or phrase, at the circled main idea, and you have only just to follow the speaker, just to be able to fill the gap with the correct word, or maybe select the correct multiple choice. Okay?
Okay.
This is extremely important. And I'm going to check if you can do that while practicing. So, as I told you before, Joel, you have to make sure that you fill all the gaps. Don't leave anything blank. Even if you are not sure about the correct answers. Why? Because you will not lose marks for incorrect answers. Try, please. You have to write something. Maybe your guessing is going to be correct, but please don't leave anything blank. And don't worry if you miss an answer as you work through the task. Please, you have to continue. You have to move forward with the recording. You don't have to lose the speaker, because if you lose the speaker, you will find it really hard to stick with the speaker again. Let me give you an example, Joel, and please listen to me. Some students, maybe they don't know how to answer, or maybe how to select this multiple choice, or let me say, fill this gap. They want to focus on this question. The speaker is speaking. If you want to focus, maybe you will lose the track of the speaker. Keep in mind that the speaker is going to speak fast. Please don't forget this. And let's imagine that you really find the answer. Now your job is to stick with the speaker again. Now sticking with the speaker again, maybe you will lose 2 questions and the speaker starts speaking with the third question. So instead of trying just to skip this question and sticking with the speaker again, now, yes, maybe you are going to solve this gap correctly, but because you spent too much time focusing on this question, you will lose 2 questions. So please, and if you have enough time, you can go back to the question and you can write your guessing, but don't lose the speaker. The speaker is speaking fast. If you lose the speaker again, you will find it hard to stick